Hello and welcome to This is Public Health. I'm Pamela Kirkland with the Columbus Health Department, part of the West Central Health District. And today we're going to continue our conversation about the COVID-19 vaccine. It's been a while since we've come to you with information, and we have a lot of changes to report. And joining me today is Dr. Asante Hiltz, who is our District Program Manager and Epidemiologist. Welcome to the show.
Good morning. Thank you.
Good to have you back. We're going to get started in just a minute, but I just want to remind people before we get into everything that if you are looking to get vaccinated, we offer those Monday through Friday at the Columbus Health Department from 9 a.m. to 1 p.m. You can come down and get vaccinated. You can go to our website, westcentralhealthdistrict.com, and do your registration online. So just wanted to get that out there before we get going. We have had some approvals with the vaccine, and we're going to talk about those right now. We've got some slides up to kind of explain to people all the information. You want to go ahead with that?
Absolutely. Thank you. So some things have changed since the last time we spoke to you. We have received FDA approval for the Pfizer COVID-19 vaccine for 16 years of age and older. Those who are between the ages of 12 and 15 years of age are approved under the emergency use authorization.
And that's an important point, I think, because a lot of people stated they were hesitant about getting the vaccine because of the fact that it was not approved. So now we have approval. So I hope that really helps a lot of people go ahead and get vaccinated.
Absolutely. And we have seen more people express interest in getting vaccinated now that that approval has been received.
Okay, and then we have some more slides.
So I'll talk just a little bit about the additional dose, and I know that there's been some confusion between additional dose and booster. So I really want to explain what the difference is. So we have received FDA approval of an additional dose of both the Pfizer COVID-19 vaccine and the Moderna COVID-19 vaccine, and that's for those who are moderately or severe immunocompromised. And that additional dose can be given to you if you are moderately or severely immunocompromised 28 days after you've received your second shot. So if you receive Pfizer first and second dose, 28 days later, you can receive the additional dose. Moderna, you've received both doses, 28 days later, you can receive the additional dose.
And our next slide shows some of the eligibility requirements for that.
So for that additional or third dose, with those who are moderately or severely immunocompromised, some of the categories include being in active treatment for solid tumor and hematologic malignancies, being a recipient of a solid organ transplant or taking immunosuppressive therapy, being a recipient of CAR T-cell or hematopoietic stem cell transplant within 2 years of transplantation, or taking immunosuppression therapy, and moderate or severe primary immunodeficiency, such as Wiskov-Eldridge syndrome.
Right, and those are things that probably most people aren't aware of, but if you are one of those people who do have some of those issues, then you are eligible to get that additional dose. So now that we have gone through the additional dose, then we need to move on to the booster dose in the next slide.
Okay, so I'll just again reiterate the difference between that additional dose, which is for people who are immunocompromised. They can get it 28 days after their second dose. For the booster, that is going to be 6 months after your second dose is complete. And this booster dose is for people who have received their first 2 doses with Pfizer. We do not have it for Moderna currently. It's only for Pfizer, and it's for people who are 65 years and older. Residents in a long-term care setting should receive a booster shot of Pfizer vaccine at least 6 months after they've received their second shot. And then people who are age 50 to 64 with some underlying medical condition can also receive a booster shot of Pfizer. And it also has to be after 6 months.
Right. Now, those two categories were approved by the FDA. Now, on our next slide, we see that the verbiage is a little bit different, and it talks about people who should receive the booster and people who may receive a booster.
Correct. So people who are between the ages of 18 and 49 years old with an underlying medical condition may receive a booster shot of Pfizer COVID-19 at least 16 months after their series of the first and second dose are complete. And then people who are between the ages of 18 and 64 years old who are at an increased risk for COVID-19 exposure and transmission because of their occupational or institutional setting. They can also receive the Pfizer at least 6 months after they've completed their first and second doses.
So with that second category, people 18 to 64, because of their occupation, what types of occupations are we talking about in that sense?
We're talking about critical infrastructure, people who work in a healthcare setting, people who even work in a school and they're around a lot of children, people who work in a juvenile detention center or in a correctional facility. So any of those institutions or facility where there's mass gathering of people.
Okay. All right. So that kind of breaks it down pretty clearly. So when we come back after this short break, we're going to talk about some of the questions that you've been sending us about the vaccine. So stay with us.
Hi everyone, I'm Darian with the Columbus Health Department, and we are encouraging all of you to go and get your COVID-19 vaccine. And when you do, we would love to hear your COVID-19 vaccine story via video on Facebook, Instagram, or TikTok. And we'll enter you into a drawing to win prizes come November 2021. And please remember, don't hesitate, get vaccinated.
I'm Dr. Vivek Murthy, U.S. Surgeon General. The COVID-19 Delta variant is infecting more people every day. If you are unvaccinated, you are at serious risk. But getting a vaccine, wearing a mask in indoor public spaces, and maintaining physical distance can help protect you and others. Most important, vaccines prevent almost all severe cases of COVID-19. Find vaccines near you at vaccines.gov.
Welcome back, everyone. Right now we're going to be talking about some of the questions that we've gotten by email and comments on our Facebook and social media pages. The first one that people want to know about is, do I need to have my vaccine card when I get a booster?
Okay, that's a great question. And the answer is yes. You need to bring your vaccine card with you. That makes the process go a lot faster for whichever agency is going to give you your shot, whether it's the health department or a pharmacy or a retail store. Bring your vaccine card so that they can see when you receive your second shot and determine if you're eligible for your booster. Now, if you don't have your vaccine card, like maybe you lost it, you can contact your local health department and they can reproduce your vaccine record for you so that you can take that to your appointment to ensure that you're eligible for the booster.
Okay, good to know. The second question is, if I have had COVID and recovered, do I need to get a vaccine? And how long should I wait to get vaccinated if I've had COVID?
This is a great question because we get a lot of phone calls about
Right.
this exact question. People want to know, I've had COVID, so I don't have to get vaccinated, and that's not true. We still want you to have the most protection if you have had COVID, and you do not have to wait to get vaccinated if you've had COVID. The criteria, if you've had COVID, you've been positive, you need to wait till you are out of your isolation. And to come out of your isolation, you've had to be fever-free for at least 24 hours. It needs to have been 10 days since you have been positive for COVID. And once you meet the criteria to come out of your isolation, you're ready to get your vaccination.
Okay, so the isolation period isn't like a set number of days like the quarantine period.
The isolation is 10 days.
It's 10 days, okay. So if you're still having symptoms though at day 9, would that mean that you can go get your shot, or do you still just have to go by the symptoms more than the length of time?
Your isolation is dependent on your symptoms, so you have to be fever-free for at least 24 hours, and you have to have your symptoms improve. So if you're on day 9 of your isolation and you still have a fever, then on day 10 you wouldn't be out of isolation yet. You would have to be fever-free without medication for a full 24 hours. So once your isolation period is over, then you can go ahead and get your vaccine.
Okay. So a lot of people have questions about what they should do if they've been exposed to someone who tested positive. And the people want to know the difference. What do I do if I've been vaccinated and I was exposed? Or people who, what do I do if I wasn't vaccinated and exposed? So we have a slide to kind of show you this information.
Okay, and it's important to draw the distinction between the two, and it's also very important if you're still considering getting vaccinated to get vaccinated so that you're protected when you do get an exposure. So if you have been vaccinated and you've been exposed to someone with COVID-19, you do not have to quarantine unless you develop symptoms. So if you have to self-isolate until your symptoms improve, that's because you've started to develop symptoms. But otherwise, you do not need to quarantine. So we do recommend that best practice, if you've been vaccinated, that you get tested after day 5 of your exposure. That's best practice, is recommended, but there's no requirement. So you do not have to quarantine if you have been vaccinated.
Okay, now we have another slide.
Also, if you've been vaccinated and you test positive for COVID, these are called breakthrough cases, so we understand that you still can get COVID if you have been vaccinated. You still have to isolate until your symptoms improve. You have to isolate for 10 days, and you have to be fever-free without using medication for 24 hours, and your symptoms have improved, and it's been 10 days since your symptoms first appeared.
Okay, that's kind of the same information, right?
Yes.
Okay, and then we have one more slide.
So if you have had COVID and recovered and you want to get a vaccine, we just talked about this, is very important to understand. You can get a vaccine after your isolation period is over in the same criteria. You've been fever-free, without using medication for 24 hours, your symptoms have improved, and it's been 10 days since your symptoms first appeared. After that, you can go ahead and get vaccinated.
Okay, so that's the important thing, right? We don't want anybody to go down and get a vaccine when they're still having symptoms. They need to be without symptoms.
Correct.
Okay. All right, that's a lot of information, but it is on our website, so you can always visit westcentralhealthdistrict.com. When we come back, we're going to talk about some survey results that we did a survey in Columbus, so we're going to talk about some of those results about what people on the street really think about COVID-19 and the vaccinations and the whole pandemic. So stay with us.
All right. So go on and live how you want. Feel the sunlight on your face. Your life is your design. Everything you want, it's okay. Feels good. Everything's gonna be all right. Woo! Got a new place, got a new life. It's a brand new day and it's all mine. Feels good. Everything's gonna be all right. Here, get by with a little bit of smile.
As African Americans, I understand that there have been some issues here as it relates to medical care historically. We all are in this pandemic, regardless of race. This is not a black thing or a white thing, that it's a human thing. I've taken the vaccine, my family members have taken the vaccine. They've done well, I've done well. And I want you to have that same comfort of it being safe as well as being effective. It's important to know your history, but you shouldn't let your history keep you from moving forward. And let's get vaccinated.
Welcome back. During the break, we realized that we forgot something very important that we didn't talk about that we wanted to cover. So what we didn't talk about was if you were not vaccinated and you were exposed to someone with COVID. So we need to know what to do about that.
Absolutely. So we talked about people who are vaccinated, but people who are not vaccinated, if you've been exposed, then you will have to quarantine for 14 days because you're unvaccinated. And if symptoms emerge, you need to get tested right away. But the recommendation is that you will quarantine for 14 days, and after day 5 that you go ahead and get a COVID test.
So you should get a test on day 5 whether you have symptoms or not?
That's right. After day 5, we still recommend that you get tested during your
right.
quarantine period.
Okay, great. All right, well, we did a survey in Columbus last week, or 2 weeks ago, rather, and Dr. Hilt is going to talk about that survey that we did in conjunction with Columbus State University and the city. So it's called Casper, and it doesn't have anything to do with a friendly ghost. So Dr.
right.
Hills, why don't you explain the survey?
Absolutely. So a lot of people think it's the month of October, it's Halloween, and so it's not Casper the Friendly Ghost. Actually, CDC has developed a sampling methodology so that we can take a sample of our community during an emergency response or prior to an emergency. And that CASPER stands for the Community Assessment for Public Health Emergency Response. And that allows us to go door to door and ask residents how they feel about any particular topic. So the last few years, we've asked questions about things like hepatitis A, and we've asked about disasters, where to go for a sheltering if you are in a disaster. And this year, of course, the hot topic is COVID, so we decided to ask questions about COVID. How do people feel about the vaccine? How do they feel about wearing masks? How do they feel about COVID prevention measures? So we wanted to hear from our residents directly. So we went knocking on door to door to ask those questions.
Okay, before we show you that survey information, we have a slide up because we want to let everybody know at this point where we are as far as people in Columbus who are vaccinated. And so we have our Columbus vaccine numbers as of October 4th.
And so as of October 4th, we have about 38% of our residents are fully vaccinated. That means they've received one dose of the Janssen vaccine, or they have received both doses of Pfizer or Moderna. And then 43% of our residents have received at least one dose. So we know that we still have some work to do. We still want to get the message out and bring the vaccine and make it accessible to people so that we can get this percentage higher.
And you know, at the beginning, we talked about the Casper survey. So this is the sample area, correct?
Correct. So these are the two zip codes that we focused our attention on for our Casper, and that was the 31907 and 31903. And in both these zip codes, our vaccination rate is less than 2%. So we understand that there's a lot of people in these communities that may not have had the opportunity to get vaccinated, and we want to increase that accessibility and also find out why. Ask them some questions. What's the reason why you're hesitant to get vaccinated?
Okay, and we've got some of those answers on our next slide.
So these survey results represent about 50 of the residents that we spoke to. We actually received a total of 114 surveys that were completed when we went door to door. And so these are the preliminary results. We will have the full results available by next week, and those will be posted on our website. But for right now, we have learned some of this information. Primary sources of COVID-19 information come from a lot of places, but what we found is that the majority of people get their information from the news and the people that we spoke to. And then about 42% of them get their information from family and friends, 38% get their information from social media, 44% get it from primary care physicians, and 32% get it from Department of Public Health. And there's some other places where people get their information from, like the CDC, or family member or healthcare organization. But this is important for us to understand in those communities, where should we be targeting our messages? And a lot of it will probably go through social media and the news.
Okay.
So another question that we ask is, do you plan to get the COVID vaccine as soon as possible? 62% of the people that we spoke to said they had already been vaccinated, but we got 20% of them that said no. 4% of them said that all eligible members plan to get vaccinated within 3 months, and 6% said that some members plan to get vaccinated within 3 months. So there's some people that just have already decided they're not going to get it. So we've asked some additional questions about why. So the next question is, what factors encourage participants to get vaccinated? And 43%, over 43% said that it's important to get vaccinated to protect those who cannot get vaccinated. So a lot of people are really concerned about those people who can't. And then 36% reported that they believe vaccines are safe for themselves and for those in their community. So they do think that it's safe. 28% said they got vaccinated because they personally know someone who had COVID-19. And we know that that is a big motivator. Either knowing someone who had COVID or someone that you know was really sick or died from COVID is a motivator to get vaccinated. 31% got vaccinated because they worried about their family and friends. And 20% said all of the above, or it's an Army mandate, that because they're at risk or because of the deaths that they see around them.
You know, that's really interesting to know that kind of information that's here right in Columbus. I mean, a lot of times we hear things about that, but we don't know where that information comes from. But we know this is from residents right here in town.
That's right.
Okay.
So another question we asked was, what are the factors that discourage participants to not get vaccinated? What's keeping people from getting vaccinated? And the majority of people, 42%, said that there's a distrust in the government. So we understand that there's some work that we need to do in that area to kind of figure out why people don't trust the government and can we change that? 37% said that they're concerned about the side effects of the COVID-19 vaccine. Again, another opportunity for us to bring some education that the COVID-19 side effects are not very severe. People do experience some symptoms for about 24 to 48 hours after, but they're not severe symptoms. 16% say that they don't trust the pharmaceutical companies. 16% also say they have a fear of needles when receiving the vaccine. And others said that they feel that their family's already healthy or they're mostly already vaccinated. And 11% reported they had a bad reaction to the vaccine, or that they know someone who had a bad reaction to the vaccine. So those are some areas that we can focus our attention on to help people understand what's stopping them from getting vaccinated.
You know, the first one up there, that they don't trust the government or they don't trust the pharmaceutical companies, that's a big hurdle to jump over, don't you think?
Correct.
Especially for us, since we follow the CDC guidelines so much.
That's right. Since we are government, we want to help people move beyond that, but we understand that it's a barrier.
Okay. All right. We have one more slide.
And some
Or two.
other interesting facts that we learned through this survey is that 76% of the people we spoke to reported they believe the COVID-19 vaccine is an effective way to prevent and control COVID-19. So people do understand that it's important. 58% believe that doctors' recommendations is an important factor in vaccine decision making. So that tells us that we should spend more time working with physicians to help encourage them to give information to their patients about vaccinations. 46% reported they have a fear of getting COVID-19, whereas 50% do not. So some people don't fear getting COVID-19. So that's one of our challenge areas. 26% said they believe that there are better ways to prevent COVID-19, and 22% reported that they do not get enough information about the vaccine and their safety. So again, because of what residents have told us, this helps us understand where do we need to provide more education.
I'm interested, though, that you were actually out in talking to people in the neighborhoods. Did any of them tell you that what they believed is a better way to prevent COVID?
Yes. So in talking to our community residents, you get to hear a lot of information that you don't necessarily capture on a survey. Mm-hmm. And a lot of them share that they felt they're in their house, they don't go anywhere. Some of them don't go out of the home because they're homeschooling, they're working from home, so they don't have any interaction with the public, and they feel like that's the safest strategy for them. So everybody's going to have a different opinion and a different process during this pandemic.
Right.
But we want to give the ultimate level of protection, which we believe is vaccination. But we understand that everybody won't do that. So still encouraging those other prevention mitigation strategies like wearing our masks when we're out in public, social distancing, washing our hands, and those other prevention strategies beyond vaccination.
Okay. All right. Well, we're going to take a quick break right now and wrap things up when we come back.
I wanna see you stand up. I wanna feel you be proud. I wanna hear you beating heart. Live out loud. You can do it on your own. Stand up now. Live you be proud. Stand up now. Live out loud. Oh.
You can think of the vaccine as protection against COVID, or you can consider it your ticket to the next big thing in life. We can do this.
We are excited to let everyone know about a new service that we are offering at all of the health departments in our district. Dr. Hiltz, would you like to let us know about that?
Absolutely. We're excited to announce that we have a new partnership with Uber that allows us to offer free Uber rides for any of the services that our health departments offer. So whether you're coming in for a COVID-19 vaccine or a HIV test or a dental appointment, you can call our COVID-19 call center and get an Uber ride. When a person comes to that appointment that they made through the call center through Uber, they will be encouraged to get vaccinated for COVID-19 at their appointment, and the vaccine will be made available to them at the appointment. But to get the Uber ride, all they have to do is call our COVID-19 call center at 706-653-6613, schedule their Uber ride. It'll be made for them. They can even make appointments in advance. So if somebody called today, they can schedule their Uber ride for next week. So please take advantage of this service. We're available in the call center Monday through Friday from 8 to 5.
Now, don't be confused, though, because it says COVID call center. It is for any service at the health department that you can come and get a free ride to the health department. And speaking of services, we're getting in flu season right now. So we want to talk about that because we want to make sure everybody knows that flu shots are available at all of our health departments and that they are recommended for everyone 6 months of age and older. And the important thing about that is that the very young and the elderly are the ones who are at most risk for complications and hospitalization from flu. So also people want to know, if I've had my COVID vaccine, do I have to wait to get my flu shot and vice versa?
And no, you do not have to wait. If you have your COVID shot, you can get the flu shot. If you're coming in for your flu shot and you haven't been vaccinated for COVID, you can get both at the same time, both your COVID shot and your flu shot all at the same visit.
In separate arms, I'm thinking?
You can get it in separate arms, yes.
Okay. Don't hesitate, vaccinate. We are available Monday through Friday from 9 a.m. to 1 p.m. at the Columbus Health Department. So if you would like to get a vaccine, you can make an appointment on our website, westcentralhealthdistrict.com. We prefer appointments, but they are not required. So we just want to encourage everyone, if you would like to get your vaccine, come on down. If you'd like to get a flu shot, come down. If you don't have transportation, call our COVID-19 call center and we will arrange a ride for you. Thank you for joining us on This is Public Health. Thank you, Dr. Hiltz, for being our guest again today.
Thank you for having me.
We'll see you again next time. Stay healthy.